I remember it like it was yesterday. It was Mother's Day weekend. My daughter sent flowers, and I thought I was allergic. My neck seized up, and I proceeded to take allergy medications. And then I had this persistent ache right under my underarm. I just wasn't sure. It radiated down my arm, and this went on for hours. I went ahead doing what I was doing, and the next morning, around 3:30, my husband said, let's go to the emergency room, and I still didn't want to go. It wasn't until 5:30 that the pain was unbearable. And because I lived near Philadelphia, I went to a local emergency room close to my home. I wanted to be seen as soon as possible. And when I got there, they checked me out, they ran tests, and they saw nothing. They were about to send me home until an administrator came in the room. And he indicated that there was a cardiologist who was doing rounds early. And the cardiologist came in and he listened to me. He looked at my family history. He looked at my past heart exams, my echocardiogram, and my calcium test scores. And he saw that something wasn't right. And then he called in the cardiac cath team. And what they found was that I was 95% blocked in my left main artery. I have received cardiology exams in the past. My grandmother died of heart disease, my mother had heart disease, and just that February I went to the cardiologist. I then followed up because in April I was having routine surgery, and while they found a little irregularity, they didn't think it was anything to worry about. I told them that my blood pressure was not normal for me. Now it was 120/70, which may seem great to most people, but for me, that wasn't normal. I knew that my blood pressure was low. I knew there were times that doctors took it more than once because they couldn't believe how low. But it had been rising, and I asked whether it was a result of age, and they said, no, it's perfect, which it may be perfect for some people, but it wasn't perfect for me. And 3 weeks after I got cardiac clearance, I had a heart attack. The main lesson I learned was really being an advocate for my own care. Too often times, women, we're taking care of everyone else. And cardiac disease is the #1 killer of women, more than all cancers combined. And for women of color, particularly Black women, it's even higher. We present in the hospitals 240% more than our white counterparts. If I could speak to other women, I would tell them, A, know your body. You know your body better than anyone. I have lived in this body for 51 years, and I know when it's not feeling right. Also, know your numbers. Make sure that you have a strong relationship with a primary care physician to find out your blood pressure, your cholesterol levels, and other necessary tests so that you know what your baseline is. And also, get in contact with a cardiologist. Here at RWJBarnabas Health, we have a team of great cardiologists to whom you can visit. And finally, be an advocate for your own health. Be a relentless advocate. Follow up. If people aren't listening, then go to the next person, but be relentless. No one is going to do it for you. You have to be an advocate for your own health.